Because as Sudan conflict continues, citizens of the North African nation grappled with new waves of diseases, leaving them with leaving affected individuals in precarious conditions. Now, amid a fragile healthcare system, thousands of dengue and malaria cases have been reported. According to doctors, more than 10,000 cases were confirmed in this month alone. Let's have more details of that in this report.
For more than 2 years, without spraying or other basic controls, Khartoum and other Sudanese cities have become ideal breeding grounds for mosquitoes. The result, a sharp surge in mosquito-borne infectious diseases. Thousands of malaria and dengue cases have been reported in just days. Doctors here in Khartoum say more than 14,000 people have fallen ill with dengue fever and malaria this month alone. A tiny fraction of those infected have died. Patients suffer high fever, severe muscle pain, and extreme fatigue. In some serious cases, dengue can cause internal bleeding, shock, or even death.
I returned from Egypt 10 days ago. I suddenly had a fever and headache. Then I was diagnosed with dengue fever and malaria. It's really painful, and the relief is low despite the medication I get here.
This outbreak has spiraled because Sudan's health system has collapsed under war. Health officials are only beginning to track the scale of the crisis.
We are now investigating the cases of dengue fever to know the pattern and the stereotyping of the disease in Khartoum state. It will help to know how big it is. It also helps in measuring the consumption of medication and the urgent interventions.
Simple mosquito spraying could have slowed the spread, but with war disturbing every service, authorities say they are helpless.
The state was occupied by the RSF militia for 2 years. Health facilities were occupied as well. This prevented any efforts to prevent the pandemics as the state was a war zone. And even medical staff were targeted and killed, and ambulances were looted.
Once busy streets are now swamps, with waste piling up and no cleanup in sight. Preventable diseases are sweeping through communities like wildfire in a country left without protection.